Hi everyone, today we'll be discussing the proposed introduction of the sugar tax in Australia and how it will affect the economic and health aspects of Australians. We will discuss the links between the sugar tax and the health problems and also arguments that oppose its introduction. The sugar tax has been a controversial topic for many years now. The tax is a surcharge that is created for sugary drinks, and the price hike was designed to make the purchasing of these sugary drinks unappealing to consumers. In doing so, the Australian government hopes to see a decrease in sugar-related health issues. Although the proposed introduction was received well, it was also met with a lot of opposition. Some people felt that putting a compulsory tax on these goods was unjust and claimed that healthy Australians with a balanced diet had to pay a tax that the Australian government was imposing to benefit those who suffer sugar-related conditions. They also stated that the tax's introduction would make no difference in bettering health in the grand scheme of things. Now we will explore obesity. Australia has one of the highest obesity rates in the world. Obesity occurs when a person consumes more calories than they burn and when they are more than 20% over the recommended weight for their age, resulting in a BMI of more than 30. Sugar in liquid form absorb in the body more quickly than in solid form. Those who consume a lot of sugary drinks put on more calories, resulting in obesity. The recommended daily sugar dose ranges between 6 to 9 teaspoons per day. An average bottle of soft drink can have up to 16 teaspoons. This is why the sugar tax is so keenly focused on sugary drinks. The tax is to make sugary drinks less appealing due to the price hike, thereby forcing consumers to opt for cheaper options, like settling for tap water at home or table water at a restaurant. Declining popularity and exposure to sugary drinks hopes to decrease the incidence of obesity and other related health problems. As we can see from the figures here, the Australian government spent a total of $56.6 billion trying to manage the condition. All this coming from taxpayers' dollars. Introducing the tax hope to free up hospital facilities for other health concerns. Taxpayers' dollars could also be redirected to other much-needed avenues such as schooling and road work from the revenues collected. Sugar is also strongly linked with diabetes. Type 2 diabetes is when the body is not producing enough insulin or resistant to it. When this occurs, the blood sugar levels in our bodies are poorly regulated, leading to other health problems. Sugar itself does not cause diabetes, but the calories gained from it leads to becoming overweight, and being so is linked to type 2 diabetes. Complications rising from diabetes can also lead to death. 10% of deaths in Australia are type 2 diabetes related. Introducing the sugar tax hopes to deter consumers financially so that they opt for healthier choices such as water, reducing mortality rates. In doing so, it hopes to put less pressure on the individual and community. Jane Martin from the Obesity Policy Coalition said a 20% tax on soft drinks would work, and it would also raise $400 million a year to be spent on obesity prevention. She said it would save 1,600 lives over 25 years and reduce the burden of diabetes and other associated health conditions. Growing up, we were always told that sugar is bad for your teeth. Now let's understand why. Dental decay occurs when bacteria in the mouth metabolizes the sugars in our foods and drinks, producing an acid which coats the teeth and strips the teeth of its mineral makeup, causing sensitive teeth or dental cavities. The introduction of the tax would minimize access to sugary drinks. In doing so, we limit the production of the acid bath to dental hard tissues, which would lead to lower rates of decay-related visits to the dentist. This also means that nasty procedures such as injections, fillings, and teeth being pulled out can be avoided. Caroline Ewan, who is an oral health therapist, says that the number of patients far outweigh the number of dental staff available to treat decay, which puts a lot of pressure on the public dental hospital system. Patients can end up waiting years before they are seen to be treated. To ease the pressure, government hospital vouchers are given to patients to seek treatment at private practices. These vouchers come from the pockets of Australian taxpayers. Introducing the tax means less incidences of decay, which means less taxpayers' dollars are invested in dental concerns and can be redirected to other issues. On the other hand, there are those that argue that consumers will be the ones paying the tax, not the sugar drink companies. They believe this is unfair as it would be the companies paying. With that said, however, if the tax was targeted at companies, soft drink prices will skyrocket of their entire range to make up for the loss. If this is the case, financially struggling Australians will be affected the most, as sugary drinks will now be a luxury they can no longer afford. There are also those that believe that sugar tax would not make a difference in bettering health at all. The workforce claims they rely on soft drinks, energy drinks, sugary electrolyte drinks to keep their energy levels up for work. Making access to these drinks harder for them will lead to low blood sugar levels and impede their productivity at work. Efficiency aside, they say that low blood sugar levels strains the body to produce more sugar to buffer the effects. The Minister for Health says that the major barrier to implementing the sugar tax, as there will be large variation in how states and federal governments implement nutrition policies. This may put some states at a disadvantage to others. A CSIRO study shows that sugary drinks only make up 1.7 to 1.8% of the daily energy intake for the average Australian, not making the tax implementation worthwhile. Others say that limiting sugar drinks alone would not impact health, and that if the government really wants to make a difference, then they should look into managing unhealthy foods in Australia. To bring everything to a close, both supporters and opposers of the sugar tax have a very strong argument, and so it is up to the Australian government and its people to reach a mutual understanding in order to ensure a healthier population without the heavy financial penalty.